Oh. Well, good afternoon. Always great to be back in Southwest Florida. We're joined by our Surgeon General, Dr. Joe Ladapo, Kevin Guthrie from the Florida Division of Emergency Management, Simone Marsteller from the Agency for Healthcare Administration, Matthew Lessig, Associate Executive Director, Cypress Grove at Health Park, Florida. And then we have State Representative Bob Rommel and U.S. Representative Byron Donalds. I want to thank them for being here. We have, over the last week, been engaging with the federal government. Under my direction, Dr. Ladapo pressured them on releasing more monoclonal antibodies. They had actually made the decision to not release any Regeneron or Eli Lilly monoclonals, and we fought back against that. They reversed that decision on Sunday, but we have the capacity to administer a lot of monoclonals. We did it during the summer. The Fed seized control of the supply in September, and as a result of that, we had to purchase some of our own, which we were happy to do. But even the ones we purchased, all the companies are basically under exclusive arrangement with the federal government. So we're here today to say we would have a site here in Collier in 24 hours if they release more treatments for us. And at the end of the day, if you look at what's going on with Omicron, on the one hand, it's a positive development compared to Delta because Omicron is much, much less pathogenic. It is not creating the same type of serious clinical outcomes on a per capita basis that we saw with Delta. It's typically upper respiratory, doesn't usually get into people's lungs like Delta variant. So that is that's something you would rather have Omicron than Delta. On the other hand, Omicron is way, way, way more contagious. I mean, everybody, probably more Americans have gotten Omicron infections in places that have it just over the last 3 or 4 weeks than at any other time during the whole thing. And so this is just something that's widely prevalent. We believe that, yes, it's less virulent. Yes, you're less likely to be hospitalized or go to the ICU, but you still have vulnerable people, senior citizens, nursing home residents, the like, who, if they are infected with this, want to have the ability to get treatment. And so we're committed to doing that. We built a great infrastructure over the summer when we had many months of very low COVID. We had very little demand for it, but we always said we could scale back up very quickly, and we can. And we would have a site in Southwest Florida, an additional one, 3 in Southeast Florida, Central Florida, Jacksonville, you name it. That will happen very quickly. So we asked for 40,000 doses for this week from HHS, and they didn't give us 40,000, they didn't give us 30,000, they didn't give us 20,000, they gave us 12,000 doses for a state that not only do we have 22 million people who are residents, but at this time of year, we probably have 25 million people throughout the state of Florida when you count snowbirds, when you count tourists, and so that is woefully inadequate for what we need to be able to meet the demand. And I would point out that is roughly half of what the federal government sent to New York, which has millions of fewer people than we do. And of course, a lot of New Yorkers are in Florida at this time of year as well. So that's just wrong. When you politicize things like treatment and give it to states you like and don't give it to states you don't like, that's not leadership. And so we're ready, willing, and able to administer, and we could do 4,000 or 5,000 a day easy, just like we did over the summer, really at the drop of the hat. And so we're asking to get more supply, and we're here today to say if we do get more supply, you'll have a place here very quickly in addition to what's already been. And there is access to it. It's just much reduced from where we would like to be in terms of what we were able to accomplish. And over the summer, we pretty much could give it to everybody once we got our site set up who wanted it. Now we're in a situation where we have a fraction of the doses being sent to our state, even though we have more people in Florida right now than we did over the summer. So it just doesn't make sense. Part of this, I think, is because the administration has never really believed in early treatment. I think their view was, remember Fauci said if you have half the people get vaccinations, you won't have any more COVID surges. Well, how's that working out? I mean, clearly that has not worked. They said, and I think they put all their eggs in that basket, and we're seeing with Omicron, that, the vaccines aren't preventing you from being infected with Omicron. Very highly vaccinated areas have very high rates of Omicron, and that's just the reality. And so you got to take the reality as you see it and make sure that you're able to pivot accordingly. And I think what we have to do is recognize that there are going to be people that are going to be infected with Omicron, vax or not vax. That's just the reality. So they put all their eggs in that basket. And I think have not been willing to pivot. And look, it's unfortunately, this was something that in the 2020 campaign, I remember Biden going around blaming Trump for all of COVID, saying 80,000 cases is it's a failure and this and that. He said he would shut down the virus. That's what he said he would promise to do. Well, now we're in a situation where that's not even close to have been true, and I think that they're trying to find kind of people to blame. He had said he'd shut down the virus, and then he said it's really a state's responsibility. Well, you can't have it both ways. I mean, you can't say you're going to do it, not do it, then say, oh, well, it's really the state's responsibility, but then kneecap us from being able to respond in the way we want to respond. So we're going to continue pushing this because we think it's very, very important. We also, and Simone Marsteller can talk a little bit more about this, because you have Omicron that is very easily transmissible and generally very mild, you're going to have people who go into hospitals for other reasons, and the hospitals are testing everyone. You're going to have people test positive and then be categorized as a COVID positive patient. And so what we've asked hospitals to do is what really should have been true from the very beginning, is to distinguish between people who were hospitalized due to COVID and people who are simply hospitalized with COVID. And if you look at that, some of the different health systems around Florida, Jackson Hospital, biggest one in Miami-Dade, has been putting out, and they basically have half of the people who are COVID positive in their hospitals aren't being treated for COVID. They came in for another reason and mostly are asymptomatic. Orlando Health, and a big system in Central Florida, similar, 50%. And Tallahassee Memorial up in Leon County, they estimate 60% of COVID positive people in their hospital system are not being treated for COVID. They're incidentally positive. And so if you look at, we've been between 5,000 and 6,000 COVID positive individuals in Florida hospitals, over the last 4 or 5 days. But I think you'd probably have to say 40%, between 40 and 50% of that are not being treated for COVID, and that's much higher percentage than we've seen in previous waves, but I think it's a function of Omicron and how it acts. Finally, Joe Ladapo we'll talk a little bit about, and then Kevin Guthrie for DEM. The federal government promised that everyone would be getting at-home tests. They would do all this stuff. They haven't really done anything that we can tell, and so we're going to step up and fill some of that gap with the at-home, focusing on nursing homes, senior communities, so that they're able to, basically our philosophy is, you get tested. If you have symptoms, get tested, figure out what it is, and if it's COVID, we want to get you treated for it, and we want that to be as easy as possible. So we're going to be having an announcement on, it's just a matter of how many, but we are going to be able to deliver some at-home tests around the state of Florida, but they've not delivered anything thus far, and so we're having, again, to fill the gap where the feds have not been able to do. And DEM, just over the last 6 months, we fulfilled about 1,500 requests from local communities for testing support, and it's been an awful lot of stuff that's been pushed down. So we're happy to do that, and we're happy to be able to help. So let's get all hands on deck. Let's make sure we have these treatments. I think that fewer people will probably need it, just because of as Omicron becomes more prevalent. I think you will see less clinical outcomes, but there may be people that need it, and we want to make sure that we're there for them. So I'm happy to be able to say that we anticipated we may need to have more. We have the infrastructure in place. We've got a lot of resources that the legislature, at my request, set aside in the fall to be able to do it. All we need is access to the treatments. And if you're not going to send us treatments, at least open up the market so we can purchase them ourselves. And we'll be happy to do that, whether it's the Sotrovimab, Regeneron, the Eli Lilly we'll do it. I mean, we probably would do the sotrovimab just because of the people think it's really effective against Omicron and Delta, which is great, but we do recognize there's still Delta, and those other medications were very effective for that. Okay, we have Joe Latipo, Surgeon General, going to come up and say a few things. Hey, buddy.
All right. Hello. So the governor has actually done a great job summarizing the status of epidemiology of Omicron here in Florida. We're all familiar with the very vertical climb in cases, which means that it means that beyond what you're seeing in the cases is actually just a fraction of what's happening in the community. The CDC, for example, estimates that only about 1 in 4 cases of COVID are diagnosed, and that may be even a bigger ratio with Omicron because clearly it's spreading very rapidly in the state. Fortunately, it's much less virulent. So we've seen a rapid increase in cases, but our hospitalizations are, they're increasing, but it's nothing comparable to the case rise, which is great news. And as the governor mentioned, a substantial share, based on the data we have from some of our hospitals, of the patients in hospitals with COVID are in the hospital with COVID rather than for COVID. So that's also good news. The governor, I love the fact that he managed, and I love it, and at the same time, it's stunning that he was the only leader in this country that managed to implement a sustainable, sensible public health program for COVID pandemic. So we have high vaccination rates in this state, not by mandates, but just by providing people with options, providing people with access, and letting them make their decisions. We've always believed that that's something that people can do, and that's been demonstrated, in contrast to the federal approach, which has been to mandate and to create division and strife and really politicize this pandemic, and by the way, still not end it, right? The spikes here are, comparable to the spikes in other states that have taken a real hard route, such as New York and California, which tells you that those strategies are failures, even though that's not what we hear. And the focus on early treatment. It's so important. It saved tens of thousands of lives in this state, and we're still doing it. We're still communicating that to our clinicians, even though Omicron is less virulent. People who have risk factors for being hospitalized or dying are first priority for getting early treatment. That includes monoclonal antibodies. It includes the new oral therapies that Pfizer and Merck have released. It also includes other off-label medications that have good clinical trial evidence, such as fluvoxamine and inhaled budesonide. A very effective therapy is fluvoxamine. It's been published, clinical trials have been published in leading medical journals, but they don't have Pfizer or Merck at their back, so no one hears about them. But a 90% reduction, for example, in hospitalizations and death in one of the fluvoxamine trials, a big trial, was published in The Lancet. No one hears about it. We have an excellent strategy here for managing the Omicron surge. And something else that my department's is actively working on is revising our testing criteria and our testing guidance. So it's not about restricting access to testing. It's about deprogramming or denormalizing this idea that you can't go anywhere unless you get tested. And if you get tested, even if you're totally healthy and you have no symptoms, then that means that you're a case. Whereas, the positive PCR test could be dead virus. I mean, if you don't have symptoms, you're not a case. And we are going to be returning our guidance from the CDC's current test everyone all the time. If you walk by someone who happened to sniffle, you might have caught COVID, so run and go wait in the line for 3 hours to get a test. So we're scaling that back, and we're coming back to something sensible, which is that we really, really, really want you to get tested if you have symptoms and you have risk factors. You can consider getting tested if you have symptoms and have no risk factors, so I'm talking about all the young, healthy people out there who have absolutely no risk factors and are very low risk for hospitalization or anything worse from COVID. And if you have no symptoms, please don't get tested. You're so unlikely to benefit from that, and you could be harmed. And we've seen that with how children have been kept from school because they've been exposed, and now they've got to stay home from school for some period of time and disrupt mom's schedule and dad's schedule and all that jazz, and disrupt their education. So again, this is guidance. People can still go get a test. I definitely understand you want to get tested before seeing mom or grandma or grandpa, but at the same time, our leadership has convinced people that there's value in that, and really there's basically no clinical evidence that there's value in that. That if you don't have symptoms, that getting tested helps anyone. So yeah, thank you.